Hello everyone, my name is Clarissa and welcome to DNP Mentor. This is my second week on YouTube and so far so good. I truly appreciate all of you that are watching my videos and I appreciate all of your support. I think it's very important that we all do our little part in promoting mental health and also trying to provide some education into removing the stigma of mental health. A little bit about me. I am a California psychiatric mental health practitioner and also a family nurse practitioner. And so that is my background. Became a nurse practitioner in 1998 and I have learned a lot of things along the way. And so the purpose of me really starting this channel is to provide other healthcare providers information on depression, anxiety, and mental health, especially the new nurses, new nurse practitioners, or others out there that want to go on and become DNPs. And then also, of course, to individuals that might want to learn more about their illness so that they can also empower themselves in seeking ways of also improving their status. So with that said, I'm going to go ahead and get started with today's topic, which is the topic of anxiety. Now, last week I primarily focused on depression, and you really can't talk about depression without also addressing the area of anxiety. Now, usually they'll come together as a couple. Not always. There are people that are only depressed or only have anxiety, but nevertheless, it's the same brain chemistry that affects, that really contributes to both anxiety and depression, and so it's really not uncommon to have both of them present in a clinical situation. So what is anxiety? Why do people have it? What are the symptoms? And what is a tool that maybe we can use to screen for anxiety? So that is what I'm going to cover in part one. Part two will be on non-pharmacological, non-medication management of anxiety. For a lot of people, that's something that actually works. There's a lot of evidence-based information that will support that. And then my third video, part three of this series, will be on medications, what we use, and also when they're indicated. And so what is anxiety? So if we all think back, especially for those that are students that are watching this, anxiety is part of everyday life, right? If you have something due, how am I going to get it done? Do I know? Am I going to pass? And so the list can go on and on. For individuals out there, the fear of COVID certainly is a big one. The other thing, people losing their job. How am I going to pay for this? How am I going to pay for my house? How am I going to sometimes even feed my children? And so usually if you're recognizing a little bit of a pattern, is a lot of the anxious related feelings are really related to something that we don't control, something that could happen and we cannot control. And so the key in anxiety, so there's that regular anxiety when we're worried about something, but usually what happens when we have those emotions is that it sort of starts us up to becoming a plan, to establishing a plan so that we can know how to overcome it, how to get better, how to get help. So it moves us into sort of like this action mode. So that is, and the anxiety goes with the situation. Now, the abnormal type of anxiety is where there's an illness. And it's something that we don't control, right? A lot of it's genetics, a lot of it is bad luck, and so it's unknown. Anxiety affects people from all walks of life, from CEOs of companies to gardeners to housekeepers to housewives to educated people, not educated people. It doesn't discriminate. And so it's important to understand that anxiety, you don't have it necessarily because it's you, okay? Not to personalize it and to see it for what it is. And so that's why I like the idea of a support group when it comes to, or a psychological group when it comes to anxiety, because people, as they're sharing their information and their story, other people in the group can say, wow, I would not have known that somebody like that actually has anxiety. So in my practice, I have taken care of, and I have a couple right now that are actual therapists. Now, it doesn't discriminate. And so can a therapist, can a psychiatrist, can a mental health provider have anxiety, depression, or any other mental illness? Of course. It's the same as if an oncologist might get cancer or a cardiologist also gets a heart attack. So it's an illness. Okay, so that's the first thing. Now, some people will come in and I'll ask, how do you have, are you anxious? Do you have anxiety? I say, well, I don't really know what that is. So a lot of people only really relate it to sort of like an emotion of doom or like a something in the pit of your stomach. Okay, anxiety is much more than that. So when we screen for anxiety, there are 7 symptoms that we look for. And the screening tool that I use in my practice is called the GAT-7. It's a quick way of assessing the severity and the impactfulness of somebody that has anxiety. GAT-7 stands for Generalized Anxiety Disorder, and 7 for the 7 questions. So let's get started into that, and then we'll talk just a little bit more, and then I will conclude. I will try not to be too lengthy so that you may have time to sort of process the information and also go on your day as well. So the first assessment question, whether or not somebody has anxiety, is, do you feel nervous, anxious, or on edge? Now, for the disorder to be there, it has to be impactful. So it has to be present about half the time in somebody's lives, usually for like a minimum of a 2-week period. So nervous, anxious, or on edge. So if somebody were to ask you and I that question today, we would say yes, there's a pandemic going around. So that's reasonable. So by itself, it doesn't mean anything. So it's sort of a totality of different symptoms and not just one. But there's one big one, which I'll mention in a minute, that sort of will say whether the anxiety is present or not. The second one is, are you worried too much about different things? Maybe yes, maybe not. Or I'm only worried when it comes to school, or I'm only worried when it comes to work. And so that really is more exclusive. And if somebody just has anxiety related to one situation, it's usually because it's a situational kind of anxiety, but not always. Now, what about not being able to stop or control the worry? And to me, this is really the key. This is the big question. Now, if I'm worried about work or school or family, but I say, well, I need to go to sleep right now, so I will just continue thinking about that tomorrow, see what my options are. So if it doesn't impact my life, or I am able to move on, to take care of myself, to rest, if it doesn't completely take over, then I would say we're good, right? Now think about it. If I'm having an anxiety moment and I wanted to record this video for you, now can I let it go so I can record this video? So it isn't that impactful into the activities of my daily living. I'm able to move on. I'm able to move my goals. So it isn't necessarily a big problem because I can let it go. Like I said, everybody has something usually to worry about, but can we let it go when we need to? Okay. So for me, that is one of really the hallmark of the assessment. Now, another symptom is trouble relaxing. So say, for example, we had a hectic day and work is difficult and we get home and now we can relax, but we can't. That's a problem because we're no longer at work. We're not there anymore. So that shouldn't be an issue, but we are bringing the work home. And remember, when there is an illness present, like the anxiety illness, it's really not a choice. Like, who wants to bring their work home? Nobody. Who wants to worry all night? Who wants to stay up? Who wants to be fidgety? Nobody. So it's when the mind is really doing its own thing in spite of us certainly not wanting that to happen. Now, another question is, are you fidgety or restless? Now, for some people, you can tell because they're pacing, right? Pace back and forth. You can tell, oh, that person's anxious, but not everybody feels that way. Some people might have that feeling inside, which goes along with not trouble relaxing, but they're not moving. And so you can't always see it, but certainly when you see it, when somebody's fidgety, you're able to recognize it. Now, another key question is, are you easily annoyed or agitated? That's a big one. And that's usually when people will come in for treatment. When they say, you know what, I'm yelling more at my kids and I don't really know why. I mean, I know they're kids and da 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 da, or I'm yelling more at my husband, or my husband told me to come because I'm just, I just snap at him. And so believe it or not, that's a symptom of anxiety. And so with treatment, can those symptoms improve? Absolutely, because those are the symptoms that we actually target. The last question in the GAT-7 or the assessment questions for anxiety is, are we feeling afraid as though something awful might happen? So think about this. If, for example, you are home and say your partner isn't home yet, and every time he's late, you worry, oh my God, he got into an accident, or he got lost, or something happened to him, sort of like that pending doom, something that you can't control, and somebody can't call you, you just assume the worst. You sort of like live in that fear. Or now, with COVID, I mean, reasonably, we get a sneeze. Oh, I wonder if it's COVID. Yes, but you don't feel anything else. Okay, it probably isn't, right? Or I'm going to go get tests. Now, the thing about physical problems with anxiety is that a lot of the times people will have physical symptoms. So, and they could be things like palpitations or chest pain or diarrhea or more pain or itchiness, rashes. So remember that the illness of anxiety is something that is caused by the brain. So it'll send, when we don't treat it, it'll send messages to the rest of the body, and we will know to go get treatment because something's happening and we don't understand why. And they'll do a cardiology workup. They'll do a gastrointestinal workup, and it's all negative. It can't be because I feel it. And yes, it's real because you're getting those signals from the brain, but there's nothing intrinsically wrong, say, with your heart or with your gastrointestinal tract. But because it's the anxiety, it's causing the symptoms indirectly because the anxiety is not being taken care of. So it's going to let you know, hey, I'm here. So pay attention to me because I'm here, and I need you to go get some help so that the body can have some peace. And so like any other illness, if you don't take care of it, the symptoms get bigger and bigger. And that's usually when the people, individuals out there will come and get some help when they're having when it's really just that discomfort or even the worry. And I say even that's very, very impactful. But when they see, for example, their concentration or they're becoming annoyed and somebody else is telling them, please go get some help. You need some help. That's usually when they come in. And so if we can recognize these symptoms as anxiety, then certainly we can establish a treatment plan so that individuals can get better. So I hope that this video presentation was helpful for either new nurses, new healthcare providers in mental health, students, absolutely, that's my target goal, or for individuals that are suffering from anxiety and that they found this channel so that they can just educate themselves as to what their illness and what they can do to get better. I'm going to go ahead and start recording part 2 and part 3. I will release new videos every Monday, and then I'm planning on doing other videos maybe on a Thursday related to a different theme, specifically for new nurses or new DNPs that want to obtain that degree. If you like this, or if you're suffering from anxiety, you want to just share that with me and maybe how this was helpful, or what symptoms you have that maybe I didn't mention. If you can make a note there in the comments, I would certainly like to read those. I hope that you give this video a thumbs up and that you subscribe to my channel, and I look forward to recording more and providing more of the information and knowledge that I have gained throughout my years.